During surgery or radiation treatment for prostate cancer, the structures within the pelvic floor are affected and urinary incontinence or leaking of urine often occurs as a result. Exercises to retrain the pelvic floor muscles may help with return of urinary control after prostate cancer treatment. It's important to know how to do these exercises correctly to make sure you get the maximum benefit. To do this, you need to know where the pelvic floor is and how to correctly perform pelvic floor muscle contraction and relaxation. This video is designed to provide you with some information about your pelvic floor and how to perform pelvic floor muscle exercises. However, despite doing these exercises, it may still take weeks to months for urinary control to fully recover. Firstly, we'll see where the prostate gland is situated in the body to help you understand why treatment for prostate cancer can interfere with your urinary control. We'll then describe how to perform a pelvic floor muscle contraction and provide a basic exercise program for the pelvic floor muscles. Only men have a prostate gland. The prostate is situated in the pelvis, just below the bladder and behind the pubic bone. At the base of the pelvis, going from the pubic bone to the tailbone, is a hammock of muscle supporting all the pelvic organs called the pelvic floor muscles. These muscles are very important in maintaining continence or urinary control. The rectum or back passage is situated just behind the prostate. This is why the digital exam of the prostate is done via feeling the prostate from the rectum. In young males, the prostate is about the size of a plum. The prostate gland is responsible for the production of fluid for ejaculation, as well as prostate-specific antigen, commonly referred to as PSA. Part of the pelvic floor involves a band of muscle which surrounds the urethra, which is called a sphincter. This sphincter is responsible for continence by stopping the flow of urine out of the bladder. The urethra is seen here passing through the prostate. The bladder gradually fills with urine produced by the kidneys. The sphincter acts as a valve, preventing leakage. As the bladder fills, a sensation of needing to pass urine is created. The urinary sphincter continues to prevent leakage until it's convenient and appropriate to pass urine. At the time of passing urine, the bladder contracts and the sphincter relaxes in a coordinated fashion, allowing urine to flow down the urethra and emptying the bladder. Surgery for prostate cancer is called a radical prostatectomy. This involves surgically removing the whole prostate gland along with the seminal vesicles. Then the bladder and urethra are reconnected. After radical prostatectomy, when the prostate has been removed, the normal process of urinary control is altered. The sphincter is affected and short-term urinary incontinence is likely to occur as a result. This occurs typically when a man moves, for example when standing up or coughing, and usually resolves within several weeks or months of surgery. However, some men have ongoing long-term problems with urinary incontinence or leaking urine. Pelvic floor muscle exercises can help in the recovery of urinary continence as they retrain the muscles and help with urinary control. The urinary sphincter is a muscle surrounding the urethra that compresses or squeezes the urethra to stop urine leaking. This sphincter is composed of two types of muscle: smooth muscle on the inside and skeletal muscle wrapped around the outside. It's a combination of these two muscles that keep men dry both when they're at rest and active. The smooth muscle keeps men dry when they're at rest by passively keeping the urethra closed. When there's any activity or downward pressure through the bladder, the skeletal muscle actively contracts and adds additional pressure to stop urine leaking. Before surgery, this will stop the urine flow. After surgery, it may take some time for this muscle to be able to stop the urine leakage when you move. Now looking at the pelvic floor from below, you can see the urethra at the front of the pelvis and the rectum behind, moving with each pelvic floor contraction. You should try doing a pelvic floor contraction in front of a mirror without your clothes on. If you're doing the contraction correctly, you'll see the base of the penis draw in and scrotum lift up. You'll also feel the back passage contract too, but the important part of the exercise is contracting the front of the pelvic floor, like stopping the flow of urine. Ensure your buttock, thigh, and upper abdominal muscles remain relaxed. Once you've done a pelvic floor contraction and held it for a few seconds, you then need to consciously relax the pelvic floor. When you relax the pelvic floor muscles, you should feel a sensation of the muscles releasing. It's important to keep breathing normally whilst you're doing these exercises. The pelvic floor contraction is a subtle movement as the muscles are very small. Do not try too hard or try to move the scrotum and penis vigorously. You should have a sense of lift internally and externally, as described earlier, each time you squeeze your pelvic floor muscles. To start, try to hold the squeeze as you count to 5, then relax. You should have a letting go feeling as you relax the pelvic floor muscle. Relax for the count of 8. Repeat this squeeze, hold, and relax 8 to 10 times. Next, do 8 to 10 quick exercises. Lift and squeeze, and then relax the pelvic floor without holding the squeeze in the middle. Do these 2 sets of exercises, the slow and the fast squeeze, 3 times a day whilst lying down, sitting or standing. Making a regular time to do the exercises each day may help you to remember. Do not overdo the exercises. Doing them too often will only fatigue the pelvic floor muscles and in fact may make the incontinence worse. Remember, rest periods are needed to help with your recovery. After surgery, it's important that you consciously try to squeeze and lift this muscle prior to doing activities that cause leakage, such as standing from sitting, coughing, and lifting. Get to know your pelvic floor before your surgery. Do the exercises and try them in several different positions and with different activities. After surgery, you need to be really diligent with doing the pelvic floor exercises. Start the exercises a day or 2 after your urinary catheter is removed. If you get pain when doing the exercises or discomfort in the area between the scrotum and the back passage, stop doing the exercises and speak to your doctor or nurse. Do not overdo the pelvic floor exercises, as the muscles may fatigue and become sore, and this can also cause worsening urine leakage. To ensure you're doing these exercises correctly and to obtain the best continence outcome, ideally you should see a continence physiotherapist who specializes in pelvic floor training. This physiotherapist will design an individual program for you when they assess your pelvic floor function, as well as progress your program as your urinary control improves. Your surgeon may be able to refer you to a continence physiotherapist. This animation is designed to provide you with some general information about your pelvic floor and how to correctly perform pelvic floor exercises prior to prostate cancer treatment and to assist in recovery of urinary continence after prostate cancer treatment. It's not intended to replace individual assessment and advice offered by your doctor, nurse, or continence physiotherapist. It is a guide only. Remember, 1. Do these pelvic floor muscle exercises 3 times a day. 2. Doing them more often will not help. 3. Make sure you consciously contract the pelvic floor muscle when you change position. Doing these 3 things may help you gain urinary control sooner after your prostate cancer treatment.